Hey everybody, my name's Heidi Ashbaugh. I'm an adult emergency physician working at Baptist, and I'm here with a coworker.
Hi, my name's Erin Walsh, and I'm a pediatrician, and I work with Baptist and Wolfson's and a lot of the freestanding ER, so I may have seen many of you around.
And we were asked to give a quick talk today about when is it most appropriate to use the ER and to answer some questions. I know there's a lot, especially with the COVID and pandemic and everything going on right now. So we were just going to try to field some questions if there are questions available or out there, and also just kind of give a little bit of a talk about information about local resources that pertain to COVID and don't pertain to COVID, and to just answer kind of anything else that comes up. So the first question we were kind of posed was, why is this important to discuss? For me personally, I think that there's not only the public health aspect of conserving resources and using emergency care, but also just so that people know when it's appropriate to use an emergency room. So I don't know, Erin, if you want to start talking about from the pediatric standpoint of things.
Yeah, so I think just in general, parents just have a natural tendency to fear the worst when it comes to their children, and they often kind of opt for a better safe than sorry course of action. The truth in that is that obviously we're happy to see you if you come in for even the most minor of injuries or ailments, but a lot of situations don't always warrant a trip to the ER, and you may end up, waiting if we can't get to you, especially with the pandemic going on. We really are stretched a little bit thin. As quick as we can get people back into rooms, we are, but I know that there has been a lot of stress and tension lately. So at the other end of the spectrum, there are cases that clearly require emergency attention. And we saw this a lot at the beginning of the pandemic, and they were waiting and ended up, at home and in an urgent care instead. So that would also be kind of on the other side of the spectrum. So we're going to kind of try to break down the differences in the care that your family will receive in the hospital, ER versus an urgent care or at their primary office.
So from the adult standpoint, I think that for me, it's things that you are worried about. Obviously, any concern for life, for limb, for eyesight, any signs of a heart attack, any signs of a stroke, if you have slurred speech, if you have new weakness on one side of your body, those are all very clear indications that you need to be seen in an emergency department and not on a virtual care visit, not with your primary doctor, and not in an urgent care. So those are clear examples for me. Obviously with COVID, it's a new disease. It's a new disease process that we're all learning about actively, and obviously have learned a lot more about over the past year. And like Erin said, you need to know some of the signs and symptoms to look out for of when to come to the ER. Coming to the ER for simply a test, if you're asymptomatic, probably isn't the best use of resources. That there are plenty of resources. jacksready.com is a local site that can give you different places that you can be tested around the city. Some of those testing options are free. There's both the PCR test and also a rapid test that take different amounts of time, but can give you pretty quick results. So those are all great things if you just need a test. If you are in the opposite end of the spectrum of that, let's say you have COVID, but now you're feeling profoundly short of breath. The oxygen levels is the big thing that has gotten especially adults into trouble with COVID. So if you happen to have a pulse ox at home, and that used to be a kind of a ridiculous thing to even expect people to have, but now in light of everything, it's a simple way to kind of look at and evaluate your vital signs, and it's something that you can buy over the counter at both CVS, Walgreens, that kind of stuff, but also I know Amazon has them. So if that is reading, what my general guideline to people is 92%. So a pulse ox measures your oxygen level. And if that's reading routinely less than 92% and you're feeling short of breath, you need to come to the ER for an evaluation. It doesn't necessarily mean you're going to be hospitalized, but it means that you need to see a doctor. So I know I see a question in there, what's a pulse ox? So it's a little machine, it goes right on your finger, and that's how your doctor measures your oxygen level. And that you can measure this at home. So it's a great little gadget, and it should give you a number and is quite easy to read at home if you know what you're looking for. Normal range for most people is 95 to 100%. For people who have other conditions like COPD is a classic one, their normal baseline may not be 98%. but they should kind of have a general sense of where they run. And if you're on oxygen already, you kind of have a general sense of what you're running. So for most healthy people, healthy adults, my kind of general guideline is if you're less than 92 and feeling short of breath, you need to come in.
Yeah, I agree. And I think with kids, just in terms of those numbers and the rate of breathing, usually we talk about this a lot with kids that have asthma and they're having an asthma attack. You can see on their chest, even through their clothes, if they're breathing very hard and fast, if they're tugging, if they can't speak in a full sentence or, count to 5 or 10 without taking a breath. That's a clear indication that you need to be in an ER right away. Not wait or call your doctor or try to get a virtual visit, even if that's the most convenient for you at the time or you're afraid of COVID. We have all the resources in the ER to provide, safety measures for your family and your child with masks and everything, even if you just run in because your kid can't breathe or your family member has a low oxygen saturation. And just to tag along on that, any child under 2 months of age, no matter what the situation, a bump, a bruise, a fever, a rash, please come to an ER. Urgent care clinics are not equipped to evaluate or treat children that young. So any ER would be available and have the appropriate staff and specialists for a child that age. It looks like there's a comment about the flex spending account. If you have a healthcare flex spending account, you can use that to buy a pulse oximeter that can be delivered to your door. And there's a link for Amazon. I think they're relatively inexpensive as well.
Mm-hmm. And in terms of, I know I mentioned the jacksready.com. There's also a COVID hotline that is sponsored by Baptist, and it has a nursing hotline. And I think that should be in the show notes. But I looked up the phone number earlier. It's 904-302-5050. And they can answer general questions about coronavirus and usually can give advice about, quarantine, when to test, testing strategies, up-to-date CDC guidelines. And throughout the year, we have had some changes in that. And that does change periodically. So that's a great resource locally if you want to speak with a nurse. If you need more, of a visit than that, the virtual place visits. So Baptist has a new, it's Baptist Health Place. It's a virtual care option. You can be seen by emergency physicians and people who regularly staff our ERs in a virtual visit. And they can give you also advice about, testing strategies, when to go to an ER. They're obviously trained physicians and can give you good advice. They can't see everything and they can't evaluate everything over the computer, but there's a lot of things that they can do to direct you to the next step. And if there's simple things, they can certainly write prescriptions and send prescriptions into pharmacies and treat a lot of simple conditions through the computer.
I know that's been a great resource for a lot of people. When primary care offices really weren't seeing, what would be considered a sick visit, which you may not even be that ill, but they just don't want anyone that has any fever or any nasal congestion, even if it's just a cold, in their office, just because they don't want to spread that to their patients that may be higher risk for COVID.
And speaking of that, I think that especially early on in the pandemic, when there was limitations on PPE or personal protective equipment in terms of masks and different things, a lot of primary care offices closed because they didn't have that appropriate PPE and they didn't have enough of it. And I just wanted to make sure everybody knows that in the emergency rooms now, we have plenty of PPE right now. We have plenty for all of our staffs. We do have the expectation that patients and families wear a mask in the ER. And especially if you are experiencing COVID symptoms, we please ask that you wear a mask appropriately. If worn appropriately, with us as well being masked appropriately, we've seen very, very little transmission in the healthcare setting. So we want you to know it's a safe place to bring yourself, your family. We have appropriate equipment to treat people right now. We are very fortunate in this part of the country to not be experiencing some of the severe limitations. Like LA County is a great example right now that's in a pretty devastating place. And we certainly hope locally that we don't get to that. But right now, I mean, we are getting more and more full, and especially as the COVID numbers go up around the country, we are experiencing that locally. So certainly you may have longer waits. It may be longer in the ER until you get a bed upstairs if you need to be hospitalized. But I just wanted to let everyone know that from the PPE standpoint, we have sufficient quantities.
Mm-hmm.
And I see a question, is it still best to mask up even after receiving the COVID vaccine? Great question, and the answer is yes. We are not mask free. And the vaccine, it's getting a lot of hype, and I guess we can start this conversation about the vaccine. It's a great place to start. I had received both of my vaccines already, and I feel very, very, very fortunate to have been in that kind of first wave of people who've gotten vaccines. I'm
very grateful.
Yeah, I mean, tremendously. And I absolutely will recommend it for all my friends and all my family. Anybody who can get it and doesn't have contraindications absolutely should. I think it's our best chance to return to some sort of pre-COVID normalcy. But in the meantime, you still need to mask up. Really what the vaccine was studied to show was the likelihood of you getting severely ill from COVID, and that was reduced sometimes up to 95%. So that doesn't mean that you can't still get it, and it doesn't mean that you can't transmit it. The studies were not shown or not studied to show how transmissible you were after you got the vaccine. And there's probably likelihood in that we may see data down the road that if you've gotten the vaccine, you may be less likely to transmit it, but we don't know yet. So we're absolutely still recommending, social distancing, masking, until we've got a majority of this country vaccinated. This is still going to be the rule of thumb.
Those are great points. And also a question that I had recently from a family was that they had already had COVID in their household. Everybody had been sick and gotten over it. And fortunately, everyone was okay if they still had to wear a mask in public and in school. And the answer is absolutely yes. I have seen patients, and I'm sure you have too, that are getting this more than once and with different symptoms the second time around. So it's still important for your own health and for the health of your family and the community to please wear a mask when you're out and about.
And as soon as the vaccine becomes available to you with your age group, or if you have other medical conditions that if you're not over 65 in the state of Florida, as soon as these become available and widespread, please absolutely sign up. It's the best thing that we can all do.
And there's another question about when Baptist is getting their physicians the vaccine and on-call physicians are still being denied. I'm not aware of that. I know many of us that are on the front lines in the higher risk areas have already been vaccinated, and most of us have received our second dose. I don't know if you can comment more about that.
Yeah, and as far as I'm aware right now, Baptist has opened up to their physicians and is now starting to open up to close family members that are higher risk. So I think that we can maybe field that if someone wants, we can try to get some more answers about that and post them in the show notes after, if that's still a concern.
And I think if there's any on-call physicians that have not yet been vaccinated, hopefully they can check their Baptist email. Maybe they got an email from the medical staff office about scheduling a vaccine, or they can always email somebody in the office to inquire.
In terms of primary care, I think that's another, if you don't have a primary care physician, the 904-202 for you is a great place to start and can get people set up with a primary care doctor that's local or convenient for them, and can also kind of work with you based on your insurance, because obviously that does depend depending on the office.
Mm-hmm.
So I just want to make sure that people have that resource, and there are a lot of different places that you will see that, but 202 for you, it's a great, also another resource provided by Baptist.
I can take this question about, there was a question, can any ER treat children? And the answer is yes. Baptist and Wolfson's have great resources at all of their main hospitals and all of the freestanding ERs. We are staffing them with pediatricians, almost not in the entire 24 hours, but almost 24 hours a day. And obviously, if you bring your child to the ER at any point in time and there is not a pediatrician on staff, there is appropriate staff members for your child that can care for your child and their needs and whatever specific illness that they came in for. Sometimes if you're at a freestanding ER and your child has to be admitted to the hospital, that does involve a transfer to Wolfson's. We tried to get that in place as quickly as possible. We have a very specialized pediatric transport team, kids care, and they can definitely transport your child down with a nurse and a respiratory therapist to track all of their vital signs en route downtown. So a lot of good resources that we have in our community to care for the children.
And like Erin said, you know, we sometimes will reference, I will reference myself as an adult ER doctor.
Yeah.
But I take care of all ages. I was trained to take care of all ages. Obviously, the pediatric ER doctors have a subspecialized set of training. So they did additional years of residency and fellowship. But we are trained, and we will absolutely take care of your child. And if we need to transfer them down to our children's hospital, we have the resources to do that efficiently. And we all work really well together to get kids of any age taken care of.
Yeah, we're a team at all the hospitals. And even in addition to that, we do have a telemedicine computer that we can wheel into the room if there isn't, you know, a pediatrician rep right available to see your child, but they need to be seen by a specialized pediatric emergency medicine physician. We just wheel that device right into the room, and your family can speak directly to that doctor prior to transfer downtown to Wolfson. So you will be able to see and speak to that doctor that you will be seeing downtown.
And they're also great resources for us if we have questions or concerns, or if we need to run stuff by them. We absolutely will call them. So that's always available to us at 24/7.
Yeah, we all work really well together to make sure everybody's family gets the best care, no matter what Baptist ER you're at. So it looks like there is another question about what level of fever in a child requires a trip to the ER. That's a great question, and I'm happy that it was asked. I get this question probably once a day, if not more. I will say that as a parent, if you're concerned about your child for whatever reason, like please come. We're happy to evaluate them and make sure that they get the care that they need. There is not a number that requires an evaluation in the ER. If your child has a fever of 104 and they're drinking juice and watching TV, you know, you can call your doctor's office, get, you know, appropriate Tylenol or Motrin dosing over the phone. Obviously, you could use telemedicine, Telescope Health, or Baptist Health Checks and get that information on a virtual visit and treat your child appropriately at home. If they're playful and happy, and you can give them the over-the-counter medicine and treat them, and call your doctor's office and schedule an appointment for the next, you know, business day where they can see your kid. On the flip side of that, I've seen children who have a fever of 101 and they can't breathe, or they have a seizure. I mean, those are definitely reasons to come to the ER. So there's really not a number. It's more clinically how the child is behaving, what symptoms do they have in addition to their fever, and just as a parent, if there's, you know, more warning signs that you think something is just not right, obviously bring them in.
And I think the one thing to add to that is there is one caveat that I would throw in there is age.
Yeah, always age.
Yeah, so less than 6 months, but particularly less than 2 months. A fever in a less than 2-month-old needs to come.
That's always an emergency, no matter the time of day.
Yeah. So Sarah, I hope that answers your question from that standpoint.
And also, I guess I can just add on to that. If you've been treating your child at home and they've been mostly okay with the fever, and the fever lasts more than 4 or 5 days, well, at that point, that does require an evaluation by a physician. So not necessarily the number, but additional symptoms and the amount of time that they've had the fever.
And that's where pediatricians are phenomenal in terms of evaluating, and not only should they know your kid and hopefully you have a relationship with them, but calling and scheduling an appointment, especially if they appear well. And the fever, and like Erin said, the number doesn't matter, especially in a kid that's greater than 6 months. We've seen a full spectrum of disease, sick and not sick, at both ends of the spectrum in terms of a number. But that is a really common question, so thank you for asking that, Sarah.
Is there a gene to track oxygen levels? Yeah, we talked about it in the beginning.
In response to the pulse ox question.
Yeah.
What do we see in the ER that could have been handled at urgent care or primary care? Okay. I think right now, the thing that we are seeing the most is the COVID, kind of mild COVID symptoms. And I will, to kind of backtrack a little bit. Not every primary care office is still seeing patients with COVID symptoms and for COVID testing. Again, that's where we encourage people to go to the jacksready.com for places to see where you can get testing. I know the Regency Mall site is still doing free testing, and that's probably been the place that's handled the largest volume of testing here in Jacksonville.
Okay.
Outside of the COVID world, there's certainly, sprained ankles, mild cough, flu symptoms, that kind of stuff that absolutely can be seen at urgent care. If you have obvious deformities of bones, probably not the place to go as an urgent care. If you're going to need a reduction, you're going to need splinting, you need to be seen in an emergency room.
Yeah, and just to add on to that, most urgent cares, unless they are pediatric specialized urgent cares, which there are none really that I know of in this area, are not equipped to really treat children under the age of at least 1, maybe even 2. A general rule is that your urgent care or doctor's office is going to be for minor, non-life-threatening situations, and the ER is for emergencies. But if you think it's a situation that can't wait, then bring your family in, because we are always happy to evaluate them. They may not need to be admitted to the hospital, but we can get them the appropriate treatment.
And to kind of further elaborate on that, Sarah, I think things that come to mind as well. So abdominal pain and vomiting or diarrhea. Some of that can be seen by a primary care or an urgent care office. If there's concern for appendicitis, then that cannot be seen. It needs a further imaging that's not available in an urgent care center or a primary doctor's office.
Yeah, and I think a lot of people, as soon as they're, especially in children, if their child has abdominal pain, I think that appendicitis is the first thing that they think of. And obviously that, we're well equipped to evaluate for that and any other causes of abdominal pain. If they've been vomiting or diarrhea just for like 1 day and they're still tolerating, something to drink, and they're still urinating, usually that can warrant a call to your doctor's office and maybe a follow-up the next day. An urgent care can certainly handle that. If you have a young child that's not urinating for at least 12 hours, their lips are very dry, or they're not making any tears, they might need IV fluids, and at that point you need to come in.
And other kind of quick things, severe burns, severe lacerations.
Seizures.
What's that?
Seizures.
Yes, seizures.
Any facial laceration, I think, in kids usually needs to be seen by us. Most of the urgent cares are not willing to even evaluate those, and we have the best resources if they need any sedation or anything.
Correct. Yeah. And then trying to think if there's a big other things. I think we've covered a lot of those. I think for this often comes up in probably our older population, so certainly away from Erin's specialty, but altered mental status or confusion, especially in the elderly, with sometimes even simple UTIs is a really common one that people can get quite confused or delirious, and that's probably not an appropriate thing to take to a primary doctor. That needs to be seen in the emergency department. Sometimes those patients need to be admitted to the hospital. There's blood work and different things that need to be done to evaluate. So mental status changes, any changes in vision, and kind of we mentioned earlier, stroke concerns. So any weakness on one side or the other. If severe, I was thinking along the lines of mental status stuff. Severe mental health concerns. Is the other one. Unfortunately, with this pandemic, it's been a pretty isolating experience for a lot of people. And sadly, we've seen mental health tragedies, for lack of a better term, both in the pediatric population, but also in older patients. So certainly if you're having suicidal thoughts, homicidal thoughts, if you're having worsening depression that's out of control and you don't have a psychiatrist that you can see, absolutely we can evaluate you in the emergency department and try to plug you in with resources, whether that's outpatient or inpatient. So that's kind of another reason to come and see us.
Most head injuries, I think, are a big concern for parents of young children. The reality is kids get hurt, they fall down, they run into walls. Any head injury where your child appears to pass out or lose consciousness definitely needs to be seen in an emergency department. Heavy, like we talked about before, heavy, fast breathing or gasping for air. unable to speak without taking, a few breaths. Those are always big indicators of respiratory distress, especially in kids. And that needs to be brought straight into the ER. There's a question from Sarah about virtual care options. And so,
yeah, we mentioned this a little bit earlier, but again, the new Baptist Health Place, you can find it online. It should also be, I think, in the notes section about where you can locate that through the Baptist Jack's website. And
Scope Health as well, I think, has a website that would direct you to the same place.
Mm-hmm. I was going to backtrack a little bit
on there.
What's that?
You'll probably get one of us on there if somebody logs in.
Very possible. And kind of just to backtrack a little bit in terms of Sarah's previous question about what you see in the ER that could have been handled at urgent care or primary care. The one thing I wanted to mention is chronic problems are probably not best served in the emergency department. If you have been seen by a primary doctor multiple times over the course of 6 to 12 months, oftentimes there's not going to be something that I'm going to find or solve in that moment in the emergency room. We do have access to an array of tests, but again, we are limited. There are a lot of tests that are send-outs. There are a lot of tests that can't be done in the emergency department. And sometimes that condition needs a subspecialist, and oftentimes your primary doctor is actually the appropriate person to refer you to the appropriate subspecialist. So I just wanted to mention that as well. We have been seeing, I think, a handful of different people that either haven't seen a primary doctor because of COVID concerns or just haven't been plugged into the system, or have, and they want either a second or a third or fourth opinion. And oftentimes I'm not the best person for that.
Those are great points. I think we see that on all ages in the spectrum. And obviously we're happy to try to do our best to get you an appropriate evaluation, but a lot of times chronic issues that have been seen and evaluated, if your child or your family member has had x-rays or imaging at a different location other than a Baptist location, we don't have access to look at those. So your primary care is going to be the best option to field a lot of your questions. And if you think you do need a second opinion or a specialist, it's always good to advocate for yourself or for your family member, for your child, and ask to be referred to a specialist.
Mm-hmm. Absolutely. I was going to say, I don't see any other questions in the comment box. I guess we can give people another minute to see if there's any other things that, any other concerns. Are our wait times online? They are posted on the website. They are generated out of kind of averages, both historically and then current. So they may not be perfect. And the one thing I will say is that our wait times have increased. Locally, we've had a big surge in not only COVID volumes, so our ERs have been busy. So wait times are certainly, we do our best, absolutely. And we have a triage system in place, and we try to get our sickest patients back the fastest. So we will absolutely do our best. And, but they are average wait times available online. Yes.
And I do want to just add on to that. There are dedicated, or we're trying to have dedicated pediatric rooms available in all of our freestanding Baptist ERs. So even if you come in and you're not triaged right away, a lot of times we are pulling these children back and triaging them in the room and trying to start their workup, whether it be x-rays or, an EKG or something like that. We're trying to get everything started as quickly as possible. So please bear with us. If one of us is in another exam room, we are getting to everybody as fast as we possibly can for whatever it is that they came in for.
All right, well, I think that looks like it's probably wrapping up. So if anybody, again, a couple things, just to kind of wrap up, BaptistJax.com has a ton of resources, the Baptist Health Place for virtual care options, the primary care, the 904-202-4U can get you plugged in with a primary care doctor, the COVID hotline, 302-5050. And then obviously if there's any emergency needs, if there's any concern, life, limb, eyesight, shortness of breath, COVID, obviously we're there for you and we're happy to take care of you or your family.
Absolutely.
I don't see any other questions popping up. So I think, all right, thank you guys all for your time. We hope this was helpful.